ladies and gentlemen. I am Kelly Vera, a student at Touro University, and it is a warm, sunny June afternoon, and I'm here to speak to you about a celebrity wellness evaluation and oral presentation of Robert Nesta Marley, otherwise known as Bob Marley. Mr. Marley presents to the clinic today with a temperature of 98.3 Fahrenheit oral, a pulse of 83 taken radially, respirations of 18, and blood pressure of 146/82 on his right arm sitting. Mr. Marley is 5 feet 9 inches tall, weighing 160 pounds with a body mass index of 23.6 and is experiencing no pain presently. Mr. Marley presents to the clinic today with a complaint of fatigue. He states that he is tired all of the time, complaining of fatigue, dizziness, exertional dyspnea, and desires to chew ice often. His past medical history and surgical history include a history of sickle cell disease as a child. He was hospitalized at 12 years of age for a sickle cell crisis. And then he was diagnosed with acral lentiginous melanoma of his right great toe at the age of 32 in 1977. And then he also suffers from hypertension that was diagnosed at 52 years of age. Mr. Marley's surgical history includes a surgical repair after a gunshot wound at a concert to the chest and arm in November of 1980. And he also has had an amputation of his right great toe at age 32 for melanoma that was diagnosed under his his toenail. Mr. Marley suffers from seasonal allergies, environmental, grass and trees. He reports that they're mild, and he takes Claritin for postnasal drip and nasal irritation. Mr. Marley is also extremely allergic to shrimp and suffers from anaphylaxis if he eats or comes in contact with shrimp. Bob Marley's current medications include amlodipine, 10 milligrams PO taken daily, as well as a multivitamin Centrum Silver taken once daily also. Mr. Marley is a 73-year-old heterosexual married male who has occasional unprotected sex with his wife, who is postmenopausal, so they don't feel the need to use contraception. He smokes 4 cigarettes a day and liberally smokes marijuana he grows on his estate. He drinks rum socially about once a week. He is retired, wealthy, and lives with his wife and 2 other children that live in the compound in separate homes on the same property. He was a recording artist of reggae music for more than 40 years. Mr. Marley practices Ethiopian Orthodox Tewahedo Christianity. Mr. Marley's family history includes his mother, who died at 81 of pneumonia after a fall and broken hip and a short hospitalization. Father died at 70 of a heart attack. Brother Richard died in a car accident in 1989. And Brother Anthony is alive and has hypertension and sickle cell trait, much like his brother. Mr. Marley received all of his childhood immunizations, but has refused to receive the pneumococcal, shingles, flu, or Zostavax vaccinations. He does not desire to receive those. Mr. Marley reports that his genitourinary system really has no problems at all. He reports his last digital prostate exam on his 70th birth year, and he has no problems with erections and is happy with his sexual encounters. He has no difficulty starting or stopping his urine stream and can empty his bladder completely. He does not awaken at night to empty his bladder. He reports no discharge, painful urination, or foul-smelling urine. Mr. Marley has an assessment that's primarily without deficit, except for his skin and conjunctiva have pallor. He has glossitis and angular stomatitis. A CBC with differential is drawn, and he has a total iron binding capacity of B12 level and iron levels. Thalassemia minor is suspected, but confirmed with the labs. He has normal serum ferritin that is noted, and normal TIBC with slight microcytic anemia that is noted, with mean cell volume that is decreased, and a red cell distribution width that is decreased as well. Red blood cells were normal. All this indicates that he has minor thalassemia. B12 levels were also a little low due to poor dietary consumption of red meat, or potentially a lack of intrinsic factor, and that would require a send-out lab, which we will draw, and I will invite Mr. Marley back to discuss those results as well. So for visit today, I have diagnosed Mr. Marley with microcytic anemia related to minor thalassemia anemia trait due to a sickle cell history, and minor anemia. That seems like the most probable diagnosis that he could have, as well as a mild B12 deficiency. So treatment for anemia and B12 deficiencies are, of course, medications. Ferrous sulfate, 325 milligrams PO daily for 6 months. The cost is $5 for 60 pills without insurance. And so the course of treatment for 6 months would be $15 for that 6-month supply. B12, the tablets that are 1,000 micrograms that can be dissolved sublingually, the cost is $2.33 for a 30-day supply without insurance. I spoke to him about other avenues of B12 replenishment, either a patch or a once-monthly shot to be given in the office, and he was agreeable to taking the sublingual medication, and since he takes other oral medications, I felt that he would probably be willing to be compliant with taking the B12 pills. So non-pharmacologic treatment for Mr. Marley's diagnosis is to consume foods rich in iron, such as liver, red meat, and legumes. Mr. Marley prefers fish, pork, and goat. And then I also would instruct Mr. Marley to eat foods rich in vitamin B12, such as clams, liver, breakfast cereals, trout, salmon, or tuna. Since he does like fish, I at least hopefully helped him identify some other sources of other fishes that were rich in vitamin B12 and hope that he can include them in his diet. Okay, anticipatory guidance for the nursing therapist Betty Newman for primary and secondary prevention. I would like to see Bob Marley stop smoking cigarettes and stop smoking marijuana. And I would like for him to minimize or completely do away with alcohol consumption, because they can deplete vitamin B12, and teaching him about how they deplete the B12 complex vitamins is probably a good thing too. and then eating foods rich in iron and B12. I'd like to see him do some sort of low impact exercise, taking a walk, maybe swimming, doing some sort of minor exercise to help increase endorphins and sense of well-being. And then I'd like for him to also identify daily intake needs for iron and B12. And then we could further explore the top 20 foods that contain these nutrients. So that would empower him, his wife, and caregivers that maybe they could help him identify nutrient-rich sources that would be beneficial for him to consume. And for secondary prevention, I'd like to see him commit to taking the supplements and dietary consumption increase to prevent further disease progression. And that's probably at least a 6-month or year-long commitment, maybe for the rest of his life, actually. And then I'd also like to emphasize the nature of this disease as being something that he really is chronic, and that he will have to deal with this for the rest of his life. And then I'd also like to have his blood levels checked at 90 days and 180 days, 3 and 6 month intervals, for the anemia and B12 deficiency, to make sure that we are headed in the right direction. And then having family members tested for the disease trait would be really helpful too, because then it could help them potentially avert deficiencies as well. And then also genetic testing to examine the exact nature of the anemia would be really helpful, and then we could pinpoint more specifically how we need to treat it. And since his anemia was not severe, we would not need to consider parenteral or IV replenishment of iron or a blood transfusion, so that's good. And then I'd also like to check his homocysteine levels, because a lack of B12 can lead to increased homocysteine levels. And for someone of advanced age with hypertension, I definitely don't want to increase inflammation in their system that could predispose them to any sort of cardiac event or any other issues pertaining to prolonged exposure to inflammation that's out of control. And then a follow-up plan for Mr. Marley would be to follow up in the clinic in 90 days with a lab draw 1 week prior with CBC with DIF, B12 level, and intrinsic factor. And sooner if the symptoms worsen, if he feels dizzier or is more short of breath, due to his advanced age, he should be closely monitored for increased fatigue and intolerance of iron supplements. They can be irritating to the GI tract and can also cause severe constipation. So we would also like to make sure that we're on track with the diagnosis, and maybe potentially look for other causes of loss of hemoglobin, such as a GI bleed or something like that. Thank you for watching, and I hope you enjoyed learning about Bob Marley and his medical issues. Here is an abbreviated list of references, and I thank you for watching. Thank you, and have a wonderful day.